feel that you not implementing that mask mandate for schools, that parents should feel disappointed in you and the state as well?
Well, first, we're over 75% of students who are now covered by a mandatory mask mandate, and we believe more and more school systems are going to be coming online because of the conversations that they are having with doctors and medical professionals. I want to make sure that our children are safe in school, and what I think we are seeing is that there is more buy-in and better enforcement when these decisions are made at a local level, and we're continuing to see that. I will say that all options remain on the table. So we're going to continue consulting our medical professionals and see how the school year goes, and all options are still available to us.
I'm going to use Harnett County as an example in our area. They still have masks voluntary. If there is a widespread outbreak in the first few weeks of school, do you believe that you should take some responsibility for that?
Well, first, I hope and think maybe that Harnett County may be changing their mind. We'll see how that works, because we've had a lot of conversations going on. We're all in this thing together, and we all need to work together to act responsibly to stop this virus.
Thank you. My next question was for Dr. Cohen, if I can, and this is about the uniform statewide mask mandate. I know, given the rise in cases, and obviously this virus has no border, just a yes or no, would you support a statewide uniform indoor mask mandate?
So we are already, as I mentioned earlier, recommending that everyone, regardless of vaccination status, wear a mask when indoors in public settings. So we are already recommending that. And what I see is a belt and suspenders of local authorities mandating that for public spaces. We very much support that. And I think that is going to continue to help us to slow the spread of the virus. So we are already recommending statewide that all folks here in North Carolina wear a mask indoors in public settings. We know what works. We have the tools. Let's use them. And I don't want to forget the fact that we still have too many people who are unvaccinated, and so our focus continues to be on getting folks vaccinated.
Today, the CDC, this question would also be for you, mentioned that they're working with 16 states, their COVID surge task force. Is North Carolina one of those states, and how are they assisting you all right now, if so?
I'd have to go back to my team on that. We obviously work incredibly closely with CDC, so I'm not sure on that point, but let us go back to our team and I'll follow up with you.
And my last question was for Director Ray on the weather. We were hearing just before this meeting out of Haywood County that 30 people were unaccounted for. Do you have a total across that entire region, how many people they are searching for?
So as I said, we have seen some reports of individuals who are missing. We know there are some coming out of Haywood County as well as some other counties. Those have not been reports that have been substantiated or confirmed at this point. I do want to stress, as we said earlier, the operation is continuing right now. They are still very much in response mode. They are still searching structures. They are conducting the wide area search. They are continuing air reconnaissance. They are continuing the work by our Swiftwater teams. And so we know that we are continuing to identify homes and identify people that need support, and anticipate that there will be potentially some of that down the road. But right now, the team continues to focus on continuing active rescue operations at this point.
And just one more question for Dr. Cohen. Last week, that letter to schools was sent to, I believe, 56 school districts that had voted to make masks optional. Do you know how many have reversed course and how many we are dealing with across the state that are still voluntary as of today?
Yes. So as the governor mentioned, we believe 75% of the students are covered by a mask mandate. Since sending that letter, we believe 12 or 13 school districts have in fact, re-looked at this, taken a different vote, and decided to go with a mask mandate. I'm grateful for them working with us. We have continued to work with additional school districts, and the governor has said we anticipate even more moving towards that mask mandate, in addition to the other safety protocols that are in that. So already seen 12 or 13, expect to see more over the course of this week. Thank you.
Thank you so much.
Dawn?
I've whittled down my list. Dawn Baum, the News and Observer. Questions about the budget and vaccinations. I'll start with the budget. Now that we're in the conference process, are there provisions that are deal breakers for you, or things that you'll really, stress when you, assuming you are meeting in person or however with Berger and Moore before they pass that final budget?
All options are on the table. There's not any single issue that would have me enact a veto or to sign the budget. It's going to be a combination of those things. We want to see the policy issues. There are a number of policy issues that would take hours and hours of meeting time and many amendments to try to get right that really ought not to be in the budget. And you can see from my budget that we want to invest more in education, in educator salaries. We want to expand Medicaid. We want to make sure that children have a sound basic education. So those are, my priorities are pretty much out there and have been for a while. And I think the leadership knows that. So we're hoping to find some accommodations. We're going to work toward getting a budget at the end of the day, but with the idea that we're not going to enact a bad budget, and we'll veto it if we have to, but we want to try to find a way forward here.
Are you going to meet with them before the conference budget comes out?
So we've been talking, and you've got the Senate and the House have very different budgets and very different ideas and a lot of disagreements. So we've sort of gone back and forth about when I would enter the process. I think that they're going to try to get some agreements amongst themselves on literally hundreds of issues that are involved in this budget and in dispute. The key thing is that they're going to let me and Senate and House Democrats actually see the budget before they roll it out and vote on it. Also understanding that there are things that I want to change, see removed, added. They are open to negotiating those things at that point. And that's what's so different about this situation, is that we want to have these discussions before the budget is voted on, and then I would have to make a decision whether to veto or sign based on a budget that I've really not had a chance to see or have any input in. And I think that we realize that that process didn't work last time, and it needs to happen this time. So I think it'll be a little fluid as to where we are already. Dr. Cohen's already talking to legislators about issues in health and human services, and we're continuing those conversations.
And then on vaccinations related to state versus local, with mandating it or having the weekly testing for most state employees. What about teachers and those that work with children that aren't old enough to be vaccinated yet? Is that something that should be mandated at the state level, at the local level?
So we want to encourage all people to get vaccinated, particularly teachers who work with students. I know that we're going to continue to work with the State Board of Education, with the superintendent of public instructions, with the local systems that employ these teachers and are making decisions about that. We put them very early in the process when we were making decisions about how to prioritize people. So we've sent the signal how important it is that we believe that educators should be vaccinated. We're going to continue to push that issue.
But nothing where any sort of mandate of vaccination versus
all options
testing.
are going to continue to be on the table, but no, not at this time.
And then for Dr. Cohen, you mentioned the booster. There's nothing on the J&J booster, which I know that you got. Lots of people are wondering what are they going to be able to do and look for once they hit that 8-month out mark.
Yeah, so the CDC and FDA announcement today was specific to the Pfizer and Moderna vaccines. They did mention that the J&J vaccine, they're looking for additional data that they hope to come in the next couple of weeks. So I, too, will be looking at that data very closely. But what we are seeing with the boosters is that you wouldn't be eligible for a booster until at least 8 months after you finish your series of vaccines the first time. Johnson & Johnson, as you know, was not authorized until the month of March. So again, from a timing perspective, they still have a little bit more time to gather more data. So I think jury is still out. Scientists are still working in terms of understanding the J&J and what will happen in terms of boosters with those.
You mentioned layering with safety. So, and that if it's 400% more likely that you're going to get COVID if you're not vaccinated, what's the risk factor for the already vaccinated people? Like, how should they, how worried should they be? How should they adjust things? Are masks as important for them as unvaccinated? Is it part of it just being everybody?
So, well, a couple of things to tease out from your question there. First, I would say that vaccines continue to show us that they are incredibly effective at preventing severe disease, hospitalization, and death. And the new data just put out from the CDC today continues to reinforce that. So for people who are vaccinated, they should feel protected from the worst of what COVID could bring. So that's great. But what we are seeing is that it is still possible for you to get COVID even if you've been vaccinated. It is much more rare, but is possible. And particularly for those of us, and I'll speak for myself, who have 2 children under the age of 12 who are unvaccinated, right? I think there are different decisions for different people. Some may live with folks who are immunocompromised or at higher risk. And so I think folks need to know that we have the tools available. They know what works. And so what I would say is make sure that you are tailoring your layered protection to your personal circumstance. I wear a mask as a CDC recommends in all indoor public spaces. I follow the Raleigh new mask mandate. But I'm also very particular because my children are unvaccinated to make sure that we are taking even more protocols because of that. And so I think that every family, every person needs to think of that. And I think that everyone needs to remember the fact that we're all in this together. And all of our actions influence our friends, our neighbors, our community. And that's why layering protection is really important. Vaccines work, they're safe and effective, but masks are also necessary at this moment when there's so much virus here in North Carolina that's unfortunately very contagious. Thanks.
Thank you.
And we'll see if we have any remote. I know we have some people on the line, so if you can identify yourself and your organization.
Question is from Tyler Fleming with Spectrum News.
Hi, Governor. This question has to deal with what we're seeing in the western part of the state. Flooding continues to harm our state just weeks after a UN report outlined startling climate predictions and updates. In light of these developments, do you feel the amount of money being invested in infrastructure for flood and climate change mitigation in the state matches the threat currently being proposed by it?
No, we need much more investment in resilient infrastructure. And as we build back after storms, we need to think about the future storms that are coming. We know that climate change has affected the ferocity of these storms, and we're just seeing it every month that goes by of things that are happening not only in our state but across the world. So as we rebuild, we need to be more resilient, and we need to invest more in resilience. And it's one of the reasons why I'm strongly supportive of the bipartisan infrastructure deal that has been struck and voted on by the Senate. I hope that we can get it out of Congress and signed by the President. We have our North Carolina Office of Recovery and Resilience. We are working on resiliency issues. We must put more emphasis on that. Next question.
Our next question is from Tess Bargeber with Fox 8. Tess Bargeber, Fox 8 here. Thanks for taking my question. Nearly all of the health departments here in the Triad say they're wanting to ramp up contact tracing teams with case numbers going up right before the start of the school year. Will the state be able to accommodate all of these requests for more tracers?
We want to increase the number of contact tracers, and I'm going to let Dr. Cohen address that issue.
Hi, thanks for that question. We're obviously working hard to make sure we have the resources in place. We've learned a lot of lessons, as well as put in some additional protocols to help use text messages and other electronic means of communication and doing that contact so that we are able to lessen the burden on our contact tracers, but we are working to fulfill all of those requests. Thanks.
Next question, please.
Our next question is from Laura Lee with Carolina Public Press.
Good afternoon, Governor. Laura Lee from Carolina Public Press. We've talked a lot about mask mandates for schools, we haven't talked as much about CDC recommendations for school testing. And I know you have an opt-in plan where I believe about 52 of the LEAs have opted in, but some larger districts have not. And we're hearing from parents that are saying there's no testing protocols for students who are already back in school for year-round. So I'm wondering what programs you have for testing, and what do you say to these parents who are concerned that there's not sufficient testing in their district?
We're encouraging testing and want to provide the resources for that, but I'll let Dr. Cohen talk specifically about it.
Hi, Laura. There's two forms of testing that we're offering completely free to our school districts. One is making sure they have access to rapid tests right on site at all of our schools. So that we want to make sure happens, as well as access to a school nurse. So that has really, there's been a lot of wide uptake of that. So I can get you the exact numbers from our team in terms of the number of school districts that are doing on-site testing for symptomatic folks. So meaning they come to school, either a teacher or a student with symptoms of COVID, and being able to do a test right in the moment. One, I think it cuts down the amount of time between knowing if that student is positive or not, but also helps in terms of quarantining and other kinds of protocols that need to be put in place. The other is on screening testing, meaning routine testing of a certain population on a routine basis, whether that's teachers, students, or both. That is also available for free to every school district working with the state. There have been a number of school districts. I do believe that the number is higher than what you mentioned, and our team can get you the exact number. But we hope more school districts do opt into that testing. Again, it's layered protocols that I think are important here. Vaccines, masks, testing, the quarantine procedures, all of these things layer together to help protect our students and keep them in our classrooms learning and safe. So we're going to continue to work with school districts to make sure that they know the options that are available to them and encourage them to take advantage of that.
Next question, please.
Follow-up, Laura Lee, Carolina Public Press.
Thanks for that. My follow-up is actually about monoclonal antibodies. And I'm just wondering, and we were talking about that as a potential treatment for people who are already infected with COVID. Do we have sufficient supply of that? And is there equitable distribution of that across the state such that anybody in any part of the state would be able to access it?
Laura, thanks for that question. So the short version is yes, we have access to monoclonal antibodies. It's available in infusion as well as just an injection. So now we are actually able to administer these treatments in more spaces. Before, you really had to be in a place that could allow for an infusion. Now that it can be done as an injection, it can be available in more locations. We are looking to make sure that there is access in wider places across North Carolina. If anything, we have seen low usage of the monoclonal antibodies, and we want to make sure folks know that it is available. I want to make sure folks who do get symptoms of COVID to get tested right away, because those monoclonal antibodies have to be used within the first 10 days of you having symptoms, and the earlier you use it, the better. So it is really important. So what I would say is get tested soon if you think you have symptoms of COVID. If you have COVID, get in touch with your doctor and make sure that you ask about this, particularly if you are older or have underlying medical conditions. But yes, we have access to the antibodies now that it's available in just a shot, an injection. We can give it in more locations, and we're working with providers to make sure that access is available widely across North Carolina.
Next question.
Our final question that will conclude today's press briefing is from Rose Hoban with North Carolina Health News.
Hi, folks. Thanks very much for taking my call. It's Rose Hoban with NC Health News. This was going back to your executive order for people in cabinet departments to, get vaccinated or provide proof of vaccination. We're curious about how that's going to be enforced. Will there be a database? And the other thing that we're curious about is how you're going to be enforcing masking, especially in places like correctional facilities. There are some of them are in pretty rural areas. So, you might have a database of folks who are vaccinated, but how are you enforcing the masking?
Well, immediate supervisors would be carrying out the rules that are put forth by the Office of State Personnel, State Human Resources. We are working closely with all of the cabinet agencies to, number one, make sure that we have a process for verifying the vaccination, and then we don't have to worry about it. But if they don't verify, then we do want to make sure that there is testing, and we want to make sure that there is masking, and supervisors will be responsible for making sure that's done. They're also working through protocols on what are the consequences for employees who just simply are not going to get tested and not going to wear masks. And we want to be together on that, so we're still working on what the ultimate discipline could be for that. The idea here is to get people vaccinated, and we're using this period of time to work to talk with people, to hear their concerns, and to convince them to get vaccinated. Dr. Cohen, would you want to add to that? Okay. So follow-up, Rose?
Yes, I do have a follow-up. Thank you. It's about verification of vaccination. We did a story about how to get your verification off of the state website. Well, it turns out that, for example, I went to a pharmacy, and the pharmacy doesn't have my verification. And my husband went to a community health center, and oops, they didn't upload things they didn't upload his email address. So what are going to be the alternatives for folks whose vaccination verifications are not in the state database?
Rose, thanks for that question. So first, I would say that the vast majority of North Carolinians have gotten their vaccine at a North Carolina provider. That means their information is accessible and they're able to easily download it. Now, if you got it at one of our federal partners, meaning at Walgreens or CVS or another pharmacy, each of those have their own portal in which you're able to access your own vaccine record. And that's what we just want to make sure folks are able to access their own record. So if you got it with a provider in North Carolina that's not a pharmacy, you can access it through the North Carolina portal. If not, then, as I said, all of those pharmacies have their own individual portals for you to access that information. I know that there are a number of places that are working with community health centers and others to facilitate their ability to make vaccine information easily available to those who have gotten it. So we're working with those and happy to support. Again, that's, I think, a national effort that is going on right now. Thank you.
Thank you all for joining us today. If you haven't gotten vaccinated, do it. Thank you very much.